Hi, this is Dr. Daniel Amen. I am so excited to be with you today. I'm going to talk about one of my favorite topics that I just think is so important, and that is killing the ants, the automatic negative thoughts that come into your mind and ruin your day, and getting rid of the little lies that make you fat, depressed, and feeble-minded. So around the world, I'm sort of known as the brain doctor, the guy that scans people's brains and then helps to optimize it. And what a lot of people don't realize is how important programming the brain is in order to keep it healthy. So brain health, if you've heard me talk before, is actually pretty simple. You avoid things that hurt the brain, like brain injuries, drug and alcohol abuse, things like diabetes, hypertension, heart disease. But negative thinking is another one of the very important things to avoid. I happy, hopeful thoughts, and the brain works so much better when you correct the negative thinking patterns and you learn how to direct your mind in a positive way. And as you'll see from the presentation, it's not just about pie in the sky, happy thinking, because it just doesn't work. I want you to think in the most accurate, effective ways, because your brain will then work better. So I have a little slide presentation for you today. And the first slide you'll see are some of the little lies that drive aging and drive obesity and drive depression and drive anxiety disorders. So things like, my memory's no good. That's normal. Well, I'm here to tell you that's not normal. That actually having memory problems is the sign of early trouble. So one of the little lies people tell themselves all the time are lies that actually put you in denial for problems going on in your brain. Another one I hear all the time that actually amuses me is, I travel too much to be healthy. Or I interviewed a person once for help here at the Amen Clinics, and he was really overweight, and I just couldn't help myself. And I said, so tell me what's going on with your weight. And he said, well, I travel a lot. And I had just finished a 22-city tour for public television, and I went, well, I travel a lot. My weight's okay. And he's like, well, I work hard. And I'm thinking to myself, probably not harder than I work. It's those little lies that you tell yourself that give you permission to act badly. Or I remember once I was interviewing Big Ed White, who's one of our NFL players. So the Amen Clinics here, we're in the middle, are actually toward the end of a large-scale NFL study. And Big Ed White was 365 pounds and 6'2". And I said, Ed, what's the deal with your weight? He said, I have no control over my appetite. If you see me as a patient, I don't let you lie to yourself. And I went, really? I said, you have absolutely no control over your appetite? And he thought about it and he said, well, that's really not true. I do have some control. And I'm thinking to myself, of course you have some control. But when you believe the lie, I have no control over my appetite, you've just given yourself permission to eat anything you want, at any time you want. Another one of my players said, I'm overweight because everybody in my family's overweight. Or I have other people say, my family gets Alzheimer's disease, I'm going to get it. And what they don't realize is about 30% of your health is related to your genes. 70% of your health is related to your behavior. So my genes, too, say I should be fat. I actually did the genetic test from 23andMe. It's a company online. You can spit in a cup and send it to them, and they'll tell you what your genetic vulnerabilities are. And I have a 65% chance that I would be fat, but I'm not. Why? Because I don't engage in the behaviors that would make me fat. So those families where you see the grandfather and the father and the daughter and the grandchildren are obese, in part it's because they're engaging in behaviors that make them that way. Everything in moderation. It's another one of those little lies, because when you actually add up all the things they have to do in moderation, there's no way they could be healthy. Or I can't find time to work out. I just had a conversation actually with one of our NFL players who I saw for his follow-up scan, which was much better, but not as good as it could be. And I'm like, are you exercising? He said, no. And it's like, well, I don't have time. And I'm like, when you don't have any time if you're dead, that making an appointment to exercise is as important as brushing your teeth, and you should brush your teeth because gum disease is a risk factor for Alzheimer's disease. So getting rid of the little lies, or it's Easter, or Memorial Day, or 4th of July, or coming up Labor Day, or Thanksgiving, or Christmas, or New Year's Eve, or it's Monday, Tuesday, Wednesday, Thursday, Friday, or Saturday. I mean, there's always a reason to cheat. There's always a reason to not be a warrior for your brain health. But what I want to challenge you today is whenever you feel sad, mad, nervous, or out of control, I want you to write down the automatic thoughts that are going through your head and correct them. And so for those of you that are part of our online community, there's a brain journal, and at the bottom of the brain journal, you can write down the thoughts going through your head. Or one of my favorite rooms in the online community, the Amen Solution, is the Kill the Ants room. Because if you go there, what you find is this exercise. Whenever you feel sad, mad, nervous, or out of control, it'll actually walk you through a very specific exercise I'm going to tell you about. So, this technique I have built over a long period of time is incredibly simple. And it's based on a therapy called cognitive therapy, or therapy for your thoughts. It was first developed by Aaron Beck at the University of Pennsylvania. They studied it repeatedly, and they found that this technique that I'm going to share with you can be as effective as antidepressant medication for people with anxiety and depressive disorders. It's been shown to help couples. It's been shown to help people who have the eating disorders. There's one study from Sweden that says if you do the technique that I'm going to share with you every day for 10 weeks, people lost 17 pounds, where this was their major intervention, was learning how to correct the automatic negative thoughts that went through their mind. So it's based on some simple ideas. Every time you have a thought, your brain releases chemicals. Every single time you have a thought. When you have bad thoughts, angry thoughts, hopeless thoughts, helpless thoughts, your brain releases a set of chemicals that make you feel bad. How do we know this? Well, we've done imaging work that demonstrated it. But I'm also a biofeedback therapist, so in biofeedback what we do is we put measuring devices on your hands, so for hand temperature and sweat gland activity. We also look at muscle tension, something very interesting called heart rate variability, and your breathing rate. And when people focus on negative thoughts. Say I had the thought, no one would sign up today, or no one will like my talk today. What immediately happens is your hands get cold, you start to sweat, your muscles get tense, your heart rate variability goes down, which is a sign of stress, and your breathing rate gets faster and more shallow, so it becomes actually less efficient. And all of those things happen immediately with negative thoughts. Now, the opposite is true, that good thoughts cause your brain to release chemicals that help you feel happy and positive. And immediately what happens when you think of something that makes you happy is your hands get drier, they get warmer, your muscles become more relaxed, your heart rate variability goes up, and your breathing goes down and becomes more efficient. And it happens immediately. So I used to hook people up to these biofeedback instruments, and then I'd ask them questions. So I'd ask them, think about your mother. And if your mother is a happy idea, so like my mom, who I adore, who's like one of the world's best moms, when I think about her, my hands get warmer, they get drier, my heart rate variability goes up, and so on. If, on the other hand, your mom was someone who beat you, who was not a good mom, and you started thinking about her, you get this automatic stress response. So it's very important to know that thoughts are powerful, and they cause emotional, physical, chemical reactions in your body. Thoughts are automatic, they just happen. They're based on complex chemical reactions and things from your past, like memories. But what most people don't know is your thoughts, your moment-by-moment thoughts, lie a lot. And that you don't have to believe every thought you have. In fact, this is something that they should have taught you in second grade. And it's interesting, I was just in my daughter's second grade class earlier this year, and I taught them about this, and it was so easy that they immediately got the concept, but no one had ever taught them. And I wish someone would have taught me when I was in second grade, because if I would have gotten this idea, it would have helped with a lot of suffering in my life. So thoughts lie, and if you want to be better, you have to take control of your own thoughts.